Osimo Daktari here. When was the last time you had sexual intercourse? Was it protected or was it unprotected? I know this is one of the questions that most people find it a bit weird when they are asked when they come to the hospital, especially women. Ndio ile unasikia wanasema maswali ya kliniki. Mbona unaniuliza maswali kama ya kliniki? Anyway, hayo ndio maswali ya kliniki because you are in the clinic anyway. So, I want to give a story, a medical story for this case. A few days ago, I think 3-4 days ago, there is this female patient. She's in her 20s. She came for a medical checkup. She came for a medical, intervention. She had some symptoms. She had abdominal pain, that is low abdominal pain. She had chest pains. She had left shoulder pain. And I want to mark you this symptom, shoulder pain. I'll explain later why it's a very important symptom for this case. She also had problem with breathing. She was having shortness of breath. On doing some vitals, her heartbeat was very much elevated. It was around 155 beats per minute. Remember, the normal should not go beyond 100, but it was 155. Her blood pressure was low. It was around 85 out of 55. Now, I did ask this patient some questions. One of the questions I asked her was, when was your last menses? When did you have sex last? Was it protected or was it unprotected? She said she was not pregnant. She was very much sure that she's not pregnant, according to her. I went ahead and requested that we do a pregnancy test, which turned out positive for this case. Now, going back to the symptoms that she presented with, that's where I'm interested in. As I've said, she had shoulder pain, chest pain, low abdominal pain. She was looking pale, meaning she was anemic. She had lost some blood, but she was not bleeding. She was not having any history of bleeding. We did some other tests. The HP level, that is blood level, was a bit low. It was around 9. We went ahead to do what we call a pelvic ultrasound scan. And do you know what? We found she had a ruptured ectopic pregnancy. Thank God she underwent laparoscopy exploration and she was able to be saved. Her life was to be saved. Now, going back to the question that I had asked, why sometimes we ask some questions which may seem to be a bit not related to what has brought you. According to her, what brought her actually, it was mostly chest pains. She was feeling weak. She was feeling dizzy. She was feeling pain. She never thought it was something related to pregnancy. But as it turned out, she was pregnant, and not only pregnant, but she had an ectopic which has already ruptured. And this is a medical emergency. But as we speak, she's recuperating well in a hospital. She underwent successfully surgery, and she'll be good. Now, when you come to the hospital and I ask you some questions, don't feel like I'm invading your privacy. Of course, it depends what kind of symptoms you have, what kind of signs you have. Those are the things that would lead me to ask some questions. So those were very, very important questions. When she had her sex last, when was her menses, was the sex protected or not protected? According to her, she never thought she was pregnant because she had not yet got her next periods. The time had not reached. She was expecting the periods in the next few days. Actually, she thought it's her menses that are coming. That's why she's experiencing the low abdominal pain. She associated it with the periods because they were supposed to come like in the next 1 or 2 days. But as it turned out, it was an ectopic, ruptured ectopic pregnancy. I will talk much more about ruptured ectopic pregnancy and the complications it can take and how it's managed. But so far, that is it for today. So next time you come and ask you, will you have sex, Lini? Don't feel like tidy. That's not a necessary question. Yes, health is wealth. Bye.